Hey everyone, you've stumbled upon Diverge Media. I'm Greg Stilly, your co-owner and host today. We will be talking about, do green EVs really benefit China the most, and what really goes into the approvals of the vaccines? What went into the approval of the vaccines we're seeing here in Canada? I have the studies right in front of me from the government of Canada of what they actually considered when making these decisions on individual vaccines. So this is going to be a good one. Make sure to like, share, subscribe if you're new to the channel. Starting with the China story. Specifically, do the so-called green EVs benefit China? Would this process benefit China? Now, we wrote an article, The Downside of Trudeau's Green Investment. He invested $50 million into an EV battery assembly plant in Quebec, alongside Quebec Premier Francois Legault, who put in another $50 million. Now, the issue with EVs is their batteries. According to the United States International Trade Commission, Journal of International Commerce and Economics, from December of 2018, they said, based on recent estimates, more than one half of the cost of a finished lithium-ion battery pack is the cost of these materials, referring to aluminum, cobalt, graphite, manganese, and nickel. It continues, among the common materials, lithium, graphite, and cobalt face supply constraints. To summarize, these minerals are essential in the production of the lithium-ion batteries used in EVs today, and they're facing supply constraints already. So what does this mean? More demand. Expect a skyrocket in the price of these materials, specifically because, according to the report, on average, as an example, cobalt made up 30% of a lithium-ion battery cathode in 2017. Although experts are trying to get this content of cobalt batteries to decline as they become more dense. Some predict a massive supply gap by 2025. The report tells us that due to cobalt's relative scarcity, some predict a 20% gap between supply and demand in 2025 alone. This will likely cause the price of the market's available cobalt to increase substantially. Indeed, the report makes note that cobalt prices increased by 120% in 2017 alone. Benchmark Mineral Intelligence continued, the market for graphite, as an example, is expected to increase from 80,000 metric tons to 250,000 metric tons by 2020, thereby driving up the price. Another mineral likely to continue rising in cost as the demand for EVs increases is lithium itself. This is seldom talked about in the mainstream media or anybody promoting these vehicles. Will they be affordable for the average person? Well, the report also points out that some have predicted a shortfall of 100,000 metric tons for lithium by 2025. This scarcity could drive up lithium's price and thus the price of battery packs. They also took note of the rising prices trend. From January 2016 to January 2018, the price of lithium carbonate in South America, one of the major sources, more than doubled. Now, here's where things get interesting. The human cost of going green. This is because the countries that would mine these minerals ethically by Canadian standards don't make up the majority of the market's mineral production. Cobalt production predominantly takes place in the Democratic Republic of the Congo, although this doesn't give us the full picture. According to a report from mining.com, the Democratic Republic of Congo, DRC, is the source of over 2/3 of global cobalt production. The report continued, though. China has over 80% control of the cobalt refining industry. It's a concerning thing to think that the DRC is the global leader of cobalt production and that child labor was a visible element there in the cobalt mining industry. Amnesty International reported in 2016 that artisanal miners included children as young as 7 years old who scavenged for rocks containing the cobalt in the discarded byproducts of the industrial mines. And they would wash and sort before it would be sold. The report continued, Amnesty International and Afterwatch conducted research in artisanal mining areas in southern DRC in April and May 2015, visiting 5 mine sites. They interviewed nearly 90 people who work or who have worked in the mines, including 17 children. So essentially, more EV production will lead to more child labor across the globe unless drastic measures are taken to address it. Without proper protection and tools, it's something known as hard metal lung disease that comes as a result of mining the mineral used in EV batteries. As CBS News reported on March 6 in 2018, according to the CDC, chronic exposure to cobalt-containing hard metal, dust or fume, can result in a serious lung disease called hard metal lung disease, a kind of pneumoconiosis, meaning a lung disease caused by inhaling dust particles. Inhalation of cobalt particles can cause respiratory sensitization, asthma, decreased pulmonary function, and shortness of breath. Another thing that is seriously concerning with the shift to EVs is that if there is a global boom in EVs, China will benefit like a lot. Let's go into what the literature says. With society demanding we turn towards green vehicles, there's been a massive motivation to shift resources towards EV production from the political classes, especially here among Canada. This may seem fine to you in theory, but there is a major concern that accompanies the shift to a global green revolution. I use quotations around the green revolution side. That concern outside of child labor is that China has control of almost all the rare earth required to manufacture the lithium ion batteries contained in EVs. Essentially, they own the battery supply production chain of new lithium-ion batteries used in EVs. Here's the breakdown. China produced 64% of the world's graphite in 2019, but only had 24% of the world's reserves. We see the same trend with cobalt, where China only has 1% of the world's cobalt reserves, but it controls 80% of the cobalt refining market. China is also among the top 5 countries with the most lithium resources and has been buying stakes in mining operations in Australia and South America, where most of the world's lithium reserves are found. They do this through programs like their Silk Road Initiative, where they make strategic investments in often poor nations that give them control of strategic land and resources, something we will play directly into if we support an EV boom here in Canada as things sit in the current supply chain. Perhaps an example of the Silk Road Initiative is China's Tianqi Lithium, which owns 51% of the world's largest lithium reserve in Australia. In 2018, the Chinese company also became the second largest shareholder in Sociedad Química y Minera, the largest lithium producer in Chile, and I hope I said that right. Another example of China's control of the EV battery supply chain is that despite China's mines only accounting for 6% of the world's manganese, they refined 93% of the world's manganese in 2019. The American Energy Alliance concluded their report by making a scathing assessment about the current direction of America under President Joe Biden, and by default, Canada's direction under Prime Minister Justin Trudeau. They said, with Biden's plans, the United States will be dependent again on key minerals for its energy system, and this time the dependency will be with one country, China. According to the U.S. Geological Survey, the United States imported 78% of its cobalt and all of its graphite in 2019. It could take 20 to 30 years for the United States to catch up with China. It could also entail the development of new mines in the United States, which have historically been opposed by the same environmental groups and politicians who have urged the United States to electrify its vehicle fleet. It is clear that electrification of the U.S. economy and its transportation system will mean the Chinification of these important parts of our economy. If you listen closely to what they're basically saying that in order to keep up with the demand for EVs, we would essentially start seeing mines that would be cobalt mines, lithium mines, things like that here in North America. They're speaking of America, but we're talking about the same type of things. So that unless America can meet our supply and their own supply demands, by default, we would have to do the same thing. In closing, although many Canadians like the idea of EVs, there are some massive questions that need to be answered before we go down this path. Are we okay with EV production increasing if it leads to more child labor globally, for example? Do we want China to stay out of our transportation systems and vehicle fleets? If so, and in my opinion, it's obviously we do want to keep them out, we can't promote EVs as they're created today. The supply chains need to be changed, and time really needs to take place in order to ramp up if this is the path people want to go down to keep the power out of China's hands. For if we do so, if we go down this path, it's to contribute to a nation that runs on a social credit system that grades their citizens each and every movement. To rush towards an EV revolution is to rush towards a world where we support a nation that imprisons over 1 million Uyghur Muslims and seeks to re-educate them for their religious beliefs. Shifting towards EVs today would mean supporting arguably one of the modern world's worst human rights abusers, and that is the Chinese Communist Party. You can't be a supporter of human rights and EVs at the same time. The hypocrisy is just too thick. All right, moving on. Now, we have the actual vaccine approvals and what the considerations were for each emergency interim approval. So the first thing we're going to do is go to the interim order, which says that they can approve it through this interim order through foreign regulatory authority. Now, that foreign regulatory authority means that they can consider outside studies outside of our country, and you'll see kind of how that plays out in the approval of each of the vaccines. So without further ado, let's get at it. Here's the interim order. It's interim order number 2, respecting the importation and sale of medical devices for use in relation to COVID-19. Now, it was by Patty Hadu. Therefore, the minister, pursuant to subsection 31 of the Food and Drugs Act, makes the next interim order. So if you go to the Food and Drug Act 31, it says, the minister may make an interim order that contains any provision that may be contained in a regulation made under this act if the minister believes that immediate action is required to deal with a significant risk, in this case they would say COVID, direct or indirect, to health, safety, or the environment. Now, an interim order has effect from the time it is made, but ceases to have effect in the earliest of 14 days after it's made. So they have to renew this every 14 days. Now, they have to reapprove this every 14 days by order in council, by the governor in council. And so you can find that by looking up the actual governor in council. You can look and search it that way if you seek to do so. But now on to what I find interesting. There's an expanded list of approved drugs and vaccines essentially under this order, this interim order. And then I found it. So we go into here, AstraZeneca, we have BioNTech, Pfizer, we have Veklury, Janssen COVID vaccine, Moderna, COVID Shield. So there's different things we have here, but it says authorization. We have the ingredients. You can read through, but then we go over. Why is it giving me trouble? Authorization or expanded indication. So it says the authorization is coming from the interim order respecting the importation, sale, and advertising of drugs for use in relation to COVID-19. Well, that is our interim order now respecting the importation and sale of medical devices for use in relation to COVID-19. So they're basically approved through, my understanding, would be the Foreign Regulatory Authority. So the question is, if they stop doing these orders in council and they're being approved for Foreign Regulatory Authority, if they stop doing these orders in council, does that mean they have to go through the regular approval processes that they would normally go through, where they would be subject to peer review? But we'll go into the actual list now. For instance, you hit AstraZeneca. We'll be posting this on Diverge Media, so every one of our loyal listeners and followers can actually share this information out. And so you can share out this video to help people navigate the actual links as well. But here we go with AstraZeneca. You have their name, authorized by interim order. That's the status. Date of approval was February 26, 2021. And we go to regulatory decision summary. We want to know why they gave it their authority to be approved. This to support the authorization of the AstraZeneca COVID-19 vaccine efficacy, immunogenicity, and safety data was based on an interim analysis of pooled data from 4 ongoing trials. 2 of these studies had sufficient COVID-19 cases to be included in the estimation of the efficacy of the vaccine. The 2 studies included a total of 11,636 participants and 5,829 in the control group. The most frequently reported adverse reactions after any dose were tenderness at 75%, pain 54.2% at the injection site, 62.3% reported fatigue, 57.5% reported headache, and 48.6% reported myalgia, which is like muscle aches. Well, here, we'll go to the definition. Deep muscle pain in a local area or widespread, dull or sharp aching pain, mild or severe pain that can last minutes or be constant, fever and chills if there's an infection, joint pain associated with muscle pain, fatigue that makes it hard to do any normal activity. So that's what it's saying about myalgia. The incidence of adverse events in the first 28 days was higher in the AstraZeneca COVID-19 vaccine group than in the control group, 37.8% and 27.9% respectively. Related adverse events, including related neurological adverse events, were also more common in the vaccine group than in the control group, 27.9% and 18.5% respectively. Most of the non-serious adverse events were reported within the first 7 days of vaccination, were self-limited, and were consistent with adverse events commonly observed following vaccination. Decreased appetite, diarrhea, hyperhidrosis were also more common in the vaccine group than in the control group. So in this case, this is tocilizumab, which is the Pfizer BioNTech COVID-19 vaccine. 2 ongoing clinical trials were provided. Study BNT 16201, a first in human phase 1/2 study. So phase 1/2 study, and study this one here, but a phase 1/2/3 pivotal clinical study. So on this one, there's a total of 9,531 subjects in basically dead even split in placebo, non-placebo group. But those who received the vaccine were monitored for reactogenicity, where injection pain site, 84.1% reported this, versus fatigue, 62.9%, headache, 55.1%, muscle pain, 38.3%, chills, 31.9%, joint pain, 23.6%, and fever, 14.2%, and were usually mild or moderate in intensity. So on the Pfizer vaccine, basically of the subset, that was 8,183 study participants aged 18 years of age and older who received the vaccine and were monitored. The most common was injection pain site. This is common with vaccines, but 84.1% felt that. 62.9% were fatigued, headache with 55.1%, muscle pain at 38.3%, chills 31.9%, joint pain at 23.6%, and fever at 14.2%. And considering if you're in a younger bracket, you might have no symptoms, and this doesn't prevent you from spreading it. It's just supposed to reduce your symptoms, thereby reducing the spread because less viral load, all these things. But if you're not going to, very unlikely to get ill and show symptoms, it doesn't maybe make sense to me in my mind to take something that is 55% chance to give me a headache, 38% chance to give me muscle pain, 31% chance to give me the chills, 23% chance to give me joint pain, and a 14% chance to give me fever. I might take the pass if I knew those numbers straight out, right? But there we are. That's Pfizer. So Moderna, we want to know, you can go adverse events following immunization. They have a whole section on that, but regulatory decision. Indication, basically 30,000 individuals were randomly assigned. Of them, 15,000 placebo, roughly 15,000 with the vaccine, separated by 4 weeks. Most frequently reported adverse reactions after any dose were pain at the injection site, 92%, fatigue by 70%, headache by 64.7%, myalgia, which is like pretty intense muscle pain, was 61%, chills by 45.4%. Basically say they went to the plant, they looked at it, and it was good enough for them to authorize under the interim order. And so that this is the reasons. You can read all the reasoning for each and every one there. But I'm curious on adverse events following immunization, what comes up on a total adverse events following immunization reports. 0.085% of all doses administered, 332 new adverse events following immunization reports since last update. There's been 2,255,000 doses administered. They're reporting 1,923 adverse events, serious and non-serious events reported. So 1,923 individual reports. They're saying 214 serious reports. Most frequently reported was anaphylaxis. Anaphylaxis is a serious allergic reaction that is rapid onset and may cause death. It typically causes more than one of the following: an itchy rash, throat or tongue swelling, shortness of breath, vomiting, lightheadedness, low blood pressure. And these symptoms typically come on over minutes to hours. So that's concerning, obviously, that we've had 214 on 2 million. Or 2.25 million roughly, people that had a sudden onset of something that can lead to death. It comes on in minutes or hours. So up to and including March 5th, 2021, a total of 15 reports identified deaths that occurred after the administration of a vaccine. This is just on the Moderna one. Following medical case review, it's been determined that 9 of these deaths are not linked to a COVID vaccine, and the other 6 are still under investigation. So there's been 15 deaths that occurred after the administration of a vaccine. They're trying to say, basically, they're going to fight and say none of them were their fault would be what they're going to fight to say, and they may be right. We'll see what the reports actually say, but we'll let you make up your mind on that and do our best to present the data and evidence on it. So that's them. Go AstraZeneca. Adverse events following immunization. It says pending information about adverse events following immunization. An adverse event is a medical incident that may occur following immunization. This cause is not necessarily related to the vaccine, and they're pending information. Advisories are published with Health Canada. Okay. Is there any advisories on this? Adverse events in Europe following the immunization with the AstraZeneca COVID-19 vaccine. So they have a few. Issue. Health Canada is aware of reports of the adverse events and would like to reassure Canadians that the benefits of the vaccine continue to outweigh its risk. Health Canada authorized the vaccine based on a thorough independent review of the evidence and determined that it meets Canada's stringent safety, efficacy, and quality requirements. So even though EU countries are questioning it now, they're saying full speed ahead. Health Canada has been informed by the European Medicines Agency that several countries in Europe have either temporarily paused the use of specific batches of the AstraZeneca vaccine or the use of the AstraZeneca vaccine altogether as a precautionary measure, pending the outcome of the EMA's investigation. None of the identified batches under investigation have been shipped to Canada. So this is their reasoning. We'll let you make up your mind what you think about that. Let's go Janssen COVID-19 vaccine. Janssen, known and potential risk. Most frequently reported adverse reactions were pain at the injection site, 48%, headache, 39%, fatigue, 38%, myalgia, 33%. The majority of these were mild and resolved within 1 to 3 days. Systemic adverse reactions were less common in participants less than 60 years of age. Serious adverse events unrelated to COVID-19 occurred in 0.4% of participants in both the vaccine and placebo groups. One case of anaphylaxis has been reported on an ongoing open label trial. Small imbalances in events, tinnitus, and seizures were noted as a contributory effect of the vaccine, could not be excluded for a minority of these cases. So there's another one that's been approved, but essentially these are being approved, and this is the takeaway here, through orders in council. So it says the authorization for importation or sale of the following requirements are met. The minister must issue the authorization if these requirements are met. The minister has sufficient evidence to support the conclusion that the benefits associated with COVID-19 medical device outweighs the risk, having regard to the uncertainties relating to the benefits and risk and the urgent public health need. So essentially, Patty Hajdu has the power to make the decision if she believes the medical device, in this case, the vaccines. The minister has, if she has sufficient evidence that the benefits associated with the COVID-19 medical device outweigh the risk, she's supposed to take into regard the uncertainties relating to the benefits and risk. But the minister determines that the health or safety of patients, users, or other persons will not be unduly affected. So I'm not sure what their definition of unduly affected is when they're saying there's some reports of seizures, anaphylaxis, things like this. And there may be a small subset, but we don't know who it's going to affect. So this is the issue. Now that's it for today. We're going to continue to look at what this means, but ultimately the takeaway here is these vaccines were approved through an interim order. And that interim order has been used to approve them. And my question is, what happens if the interim order gets removed? Do they go back to the other regulatory processes? Have a great night. Enjoy yourself, and make sure to subscribe if you're new to Diverge Media.